Welcome, Dr. Lynn Byerly, a board-certified ophthalmologist at Naples Eye Physicians in Naples, Florida. She is a graduate of Northwestern University, and she earned her medical degree at Rush Medical College and completed her ophthalmology residency at the University of Chicago. Dr. Byerly is a member of the Collier County Medical Society, the American Society of Cataract and Refractive Surgery, and the American Academy of Ophthalmology. In addition to her medical practice, she volunteers with Jamaica Outreach Program, an organization that provides food, clothing, education, community services, and medical care to improve the lives of those struggling with poverty in Jamaica. Lynn, welcome to One Spark at a Time.
Thank you. Thank you for having me.
Delighted you could make the time. I know it's difficult with a busy practice like you have. How are things with you right now?
Things are fine. We are open and seeing patients. We have actually been this whole time. We're trying to keep people out of the ERs and the urgent cares and see whoever needs to be seen, especially at the beginning. Now we're a little bit more open than we once were, but we've been operational the whole time. Now we're operating again within the last few weeks. But certainly there are people to see and patients who need to come in. We're taking a lot of precautions. Everyone is wearing masks and we're wiping things down and keeping the waiting rooms empty and not too many people in at the same time. So it kind of makes for a longer day, but I think we're keeping it safe, which is comforting.
I'm sure it's an added level of challenges you didn't anticipate, and you probably couldn't have anticipated years ago when you decided to pursue this path. When did you know that you wanted to be a doctor?
Oh, goodness. I always knew I wanted to be a doctor. You know, when I was little, I thought I wanted to be a vet. And then as I was getting older, I thought I wanted to be a pediatrician. And then when I went through medical school, well, actually, when I was in college, I thought if I really don't want to be a doctor, I should figure this out fast because pre-med is really hard. So I worked in an emergency room and decided I do like patient care and that I wanted to go to medical school. And then when I was going through medical school, you get to sample all the different specialties. And I quickly learned that pediatrics wasn't what I wanted to do, although it's a very noble profession. It wasn't for me.
Sure.
And I decided I wanted to do something more procedural that I could operate and see patients in the office. I didn't really want to be based in the hospital. Figured that out pretty fast. And I knew I wanted to have a family, so I needed to have a family-friendly specialty.
So this ophthalmology fit the bill on many of those.
Ophthalmology is really cool because you can work Monday through Friday and you can fix a lot of problems for people. So you don't just diagnose, but you can fix. The technology is rapidly advancing at all times, so that's fun. Because you can keep up with things and try new effective measures to help increase people's vision. And of course, vision is one of the most coveted senses, and people get a lot of pleasure out of their vision, and so you can help improve people's quality of life significantly. So I enjoy it very much.
So it really lets you make an impact on the way people experience their world.
I feel like that is all true. And I get to see men and women and all ages and fix a lot of problems and come out feeling, with a lot of job satisfaction.
It sounds like something that one of the things that motivates you is a passion for wanting to help people and make their lives better. What do you attribute that sense of value of caring for others to come from?
That's interesting. So when I was younger, I felt like I wanted to give back to the community. I always felt like that was something I needed to do. There was a lot of nobility in all professions, certainly, but I felt like I needed to have a direct impact, and that was important to me. I also felt like I wanted to be independent financially, always. So I felt kind of driven to have my own career and be able to manage on my own. And I don't want to minimize certain other professions, but I have a sister who does advertising. She's so creative and she's so good at it, but I couldn't imagine myself in that type of a world. I felt like I wanted to have more of a direct impact. So I always thought I wanted to do something like that was meaningful with my life and my time. And I've always wanted to do like some kind of philanthropic element to my profession. And it's a challenge to figure out how to best find something that suits your lifestyle and that you can actually be productive at, because many of the opportunities are complex or cumbersome to get to and hard to contribute to, sometimes poorly organized. So you'll show up and it's not like your best talents are utilized. So it's been kind of challenging to figure out how to actually get in and get my hands in and do something. But yeah, I always kind of thought that I wanted to do something that was meaningful. I've always been like that. I think I was born like that.
That's a great passion to have, and a good sense of wanting to care for the world and make things better for others. How did you come to Naples, Florida?
Oh, that's a good question. Okay, so I grew up, well, I was born in Marin County in California, and my mom is from San Francisco. My dad was from a farm town in Illinois, and he was the first to go to college in his family and went out to University of California to do his master's degree in economics, and met my mom, who was an undergrad, and they ended up staying in San Francisco. And then they had me and my sister and decided we were going to not be raised in California. They wanted to raise us in the Midwest. So we grew up in Peoria, Illinois. And then I went to school in Chicago. And I went back to Peoria to work for a few years. I didn't expect to, but the mom group got kind of meddling into my business. And the next thing you know, I married one of my mom's bridge group's sons. So we were in Peoria, and I thought we would stay. We, built a house, and the medical community was strong. We had both sets of grandparents there. And then things just changed for us business-wise, for my husband and myself, and he had an opportunity to start the Naples Jet Center. So we came down in 2007 for him to work in aviation. And I was 8 months pregnant with number 2 and said, okay, let's go for it. And then I found this group here, and I joined two guys in a practice, and one of whom has retired because he hurt his finger. So now there's 2 of us, me and one other guy, and we're in a private practice just south of Coastland Mall off of Goodlet Road. So we've liked Naples very much. I wasn't sure how it would be when we got down here, and I think I accosted a young family at Skillets one day and said, are there parks and libraries and schools, and what do your kids do? And I've been very pleased. My kids are doing great and very happy and thriving, and my practice is very good, and lifestyle-wise, Naples is unbeatable.
Well, it certainly is a wonderful place for all of us to be, this little sliver of paradise. So you mentioned your practice. Tell us about that a little bit for our audience. What is your typical time like? You shared some of the things that are happening right now with COVID-19, but what's your general practice life like? So
I see patients almost every day. They come in with all different kinds of eye problems. Some of them are just for a checkup. They have glasses or contacts, and some of them have more acute issues like pain or irritation. Sometimes it's vision loss. Sometimes it's like chronic things like glaucoma or macular degeneration. A lot of cataracts in Naples. So I do a lot of cataract surgery. I typically operate 1 to 2 days a week, and then I'll do procedures in the office any day. And so that keeps me busy. Seeing people, solving problems, doing procedures, and going to the OR keeps me busy. I do a lot of eyelid skin cancers, like droopy eyelids, everted eyelids, eyelid lesions, things like that.
Yeah. It's a busy practice that you have. And between that and family life, you mentioned before a passion to also do philanthropy, and you work a lot with the Jamaica Outreach Program. It's a remarkable organization. Can you tell our audience about what that work is?
So the Jamaica Outreach Program is a program to reach out to people in Kingston, Jamaica, to help them see better and have a better quality of life. They don't have access to healthcare like efficiently. They have to. It's more of a socialized system where they have to wait a long time, and they may never get in to see a surgeon. They may never get in to get an evaluation, and so there's an issue with finances. So the haves in Kingston are fine, but the have-nots are not really fine, and they don't have the money to see somebody, and they don't have the money for glasses, and they certainly haven't been evaluated for cataract surgery. So typically, the way that it works is about 4 times a year, a group will go down to evaluate a number of patients and see who needs glasses and who needs cataract surgery. And then we'll follow up with a cataract trip to do the cataract surgeries. In a couple of days, we'll do about 30 to 40 cataract surgeries and probably about 10 glaucoma procedures and a couple of lasers. And we'll do that in a couple of days, and then somebody will come back the next week to check we'll do the 1-day post-ops, and then we'll have a group go down the next week to do the 1-week post-ops, and then it will start again. So usually the surgeries are done about somewhere between 2 and 4 times a year, depending on how much access we can get to the center, and the evaluations are typically about 4 times a year.
How did you get connected to this program in particular?
So I've been looking for a way to find a philanthropy that I can help with. In fact, when the earthquakes hit Haiti, I wanted to go down. Bruce is a pilot, and I wanted to go with him. And he said, it's probably better if one of us goes at a time. It was really questionable how safe it was at that moment. And so I think Nico my youngest was just an infant at that point. So he did his thing, and I held back. And then I'd been kind of ongoing looking for something to do, and certainly, like you mentioned, my time is limited with house, family life, and then work life. So the fact that this was accessible as far as the location to get to Jamaica isn't like going to Africa. That was manageable, and there was a surgery center that we could use without having to bring down all of our heavy equipment, which was wonderful. We kind of have to work with this Jamaican doctor to try to make it work. He's great, but a little bit hard to pin down. So there are some like islander scheduling issues with it, but I guess it was practical is the short answer. It was practical. I could get there. They needed help. And I found it, and it was ready to roll. So I could come in and tangibly help by doing surgeries and exams, and it didn't need to be the wheel didn't need to be reinvented. I could get in with it. And some of these other places, it's a little harder to jump in and do something.
And I imagine that there's got to be challenges going from the medical system here to the medical opportunities that are there.
Yeah, there are a lot. Scheduling is a big thing because they're not like on the same kind of like time respect as we live our lives. If you have an appointment at a certain time, that's what you do. And transportation's an issue. Understanding what medications they take or maybe aren't taking but should be taking is an issue, like what kind of medical problems we have going on. Even communication's hard, although it's mostly all English. It's like Islander English, so there are some challenges with that. We have a real reliable director from their church down there that helps us with transportation and scheduling, and she's kind of a go-between, and that really helps keep a track of how to get a hold of people, because not everybody has phones, and to reach the people that we found that have the cataracts, to get them to come on the day that we're supposed to do the surgery, it's a lot of logistics that need to be dealt with, and then we need to pick them up, and we need to give them their medications, we need to take them home, and then we need to get them the next day to check their 1-day post-ops. So there are a lot of things that have to be kind of crossed.
I can imagine. And you actually shared with me some of the photos. I'm going to share some of those now. Would you mind talking to us about what some of the photos are that we are seeing?
Sure. Yes, that's where some of these people are living, in the ghettos of Kingston. That's a crew outside of the surgery center, and there we are in surgery. It's one of the nurses. She's helping hold the patient still because they have no anesthesia. So the guy on the right is the one who owns the surgery center. And interestingly, he's a runner. He runs with Usain Bolt. He's about 6'7".
Wow.
Yeah, you can't tell because I'm not standing there.
It's more shots of the community, I imagine.
Yeah, it's very impoverished. So this is the waiting room in the clinic, not at the surgery center. The clinic is at the church. The church is a good foundation for reaching out to people. This woman on the left is the one that I was saying from the church that is real organized and can help us.
Ah.
Yeah. So there we are with some of our staff and our crew. And then the guy on the left, he is kind of like our quote unquote bodyguard. There's a lot of violence in Kingston, and he just knows everybody. So if you're with him, you're considered safe. And he kind of helps smooth it all out. So when you're driving around, you have somebody like that with you. We don't drive, they do the driving, and then you bring him around, and then he gets a little bit of a cash for helping us. You have to bring some cash money. So she's one of the surgeon who owns the surgery center's assistants that cleans the instruments. They don't have a sterilizer. They wash everything with soap and water. It's different than it is here, different regulations. This is one of our patients that I operated on and one of my assistants. Here we are in the operating room. Yeah, afterwards you can see. So she came in with very poor vision, and there I am on the left. And after her surgery, she could see us. It was pretty moving.
Yeah, they're remarkable, the images that you have. I'm sure that there are some wonderful stories as well that go along with some of the people that you've had a chance to meet down there. Are there any in particular that touched you that you can share with our audience?
Certainly. You know, it's tough because when people develop a dense cataract down there, they feel like it's the end, like there's nothing to do, you know, and if typically one eye will accelerate faster than the other eye, the development of the cataract will accelerate faster. So they'll lose one eye and they'll just kind of walk away from that feeling like, well, that's that. And then when the other eye starts to go, they start to make lifestyle adjustments, but they just put up with it. They don't drive, mostly they don't drive. And so they feel like that's it. So coming in, I had this one guy who had lived like that for quite some time. When we went back to do his surgery, he was nervous, but also comforted in the fact that we were going to try something. It was kind of different than it is here. Here, people like to be in control, and there they don't feel like they're really in control of a whole lot. So they're giving it all to you, and you know, wishing you well as you endeavor down this surgical path. So we get into the operating room. He has like a 2mm pupil, which is really challenging. We like the pupil to be nice and big so we can get in and see the cataract. So I have to do a pupillary stretching approach, and then the cataract that we're operating on is so dense that there's special equipment that will actually break the cataract into little pieces in a atraumatic fashion so that the tissues are there. So it's a very challenging case. And also, when we're doing the surgeries there, patients are not anesthetized. So we've got somebody holding their hand.
There's no anesthesia at all.
Nope. Sometimes they get a Xanax if they need it. And other than that, they get a lot of blood pressure medication, which is oral before we get started. I shouldn't say a lot. It's usually one pill, but it's in a lot of people because a lot of them have high blood pressure, and then we're giving them these medications to dilate their eye that could raise their blood pressure more. So we give them a blood pressure med and sometimes a Xanax, and then they're laying there kind of giving over their trust to you, who you've just met them, and our nurse is holding their hand. So this guy was very patient. He was great, and he went home with a patch over. It was pretty swollen. The next day, he could read the 20/30 line, and he cried. It was very moving. It's very moving. So it went from no vision in either eye to 20/30 the next day, and it's very touching. And of course, you know, they're not a people who complain a whole lot. You know, when he couldn't see anything, he wasn't telling me how horrible his life is or how he can't work or how he can't do anything. It's kind of like they just kind of concede to the situation. And then when you can improve it, it's just all that more exciting and fulfilling for them. It's really special.
It's got to be so moving to be able to be there and, as you said earlier, to change someone's life and to see that impact in real time.
It is. It's hard to put words to it.
So with all that's going on, when will your next trip be?
Good question. So we were going down March 14th, and that didn't happen. And so now we're just kind of regrouping as people are considering possibly getting on airplanes, but really, you know, even if people are currently considering getting on airplanes, they're going to like a safe spot. They're not just kind of venturing out. So I don't think anybody's ready quite yet. I don't think even in Kingston they're ready for us yet, but hopefully we'll be able to get down there soon. We should check on our all of our post-ops have been taken care of up to this point, but it would be nice to recheck and just make sure everybody's doing okay. And then I certainly know we have a long list. I think we have at least 80 right now that are waiting for us.
Wow. A question from our audience is, if you know from your contacts there, what the impact has been from the pandemic in Kingston.
Yeah, you know, it's been tough. It's a densely populated area, especially in the slums that you saw. And people have close quarters. They don't have means for, you know, a lot of education or preventative measures. So it's been tough. It's been tough. I think that people are trying to limit their encounters, but I don't know that they're able to really do as much as we do here in the States, but it's been scary for all, and it seems like their numbers are reflective of kind of a slum-like area. You know, that in the more densely populated neighborhoods, it's certainly tough to keep people apart, especially with the low education but I don't know what their death rate is currently. I haven't looked recently. That's something that I should look at. But certainly medical care is not accessible. So I don't know if their numbers would, like, of cases would really be very accurate.
You imagine it be underrepresented or underreported at this point.
Yes. Yeah, for sure.
So another question from our audience wanting to know, they think it's phenomenal what you're doing in Jamaica. Are there similar programs in other countries or even in America to help those who are impoverished to receive the eye medical care that they need?
So in the U.S., yes, there are a lot of philanthropic programs. Like here we have in Naples a neighborhood health clinic where in Lions Club, where they'll contact ophthalmologists. If they don't have what they need, they'll contact outside ophthalmologists and ask for pro bono care for certain cases if they need it, and generally that's not a problem to agree to that. And they also have at Lions Club, they have eye lanes, exam lanes, and at neighborhood health clinic they generally want to bring patients into your clinic. So in Naples we have some help, and in other areas there are programs to help either those who are really impoverished, or even those who kind of fall in between the need for like Medicaid and insurance. There's some people who are working poor and need to have some help, and so there are programs in the U.S. to help that. In other countries, it's tough. It depends on where they are. You know, they're poorly organized, and you need a clean, sterile spot to be able to do this. It's not something that you can kind of run on the fly. But there is there's an airplane called Orbis that flies around, and it has operating rooms in it. And so ophthalmologists can kind of fly in and operate in their plane and then leave. So that's something that the American Academy
Never heard of that before.
has supported. Yeah, it's cool. Yeah, it's cool. So they do a number of mission trips each year also.
Is that also something that you participate in personally?
I haven't tried, no, but it would be interesting. They're I don't know what they're running right now because the world is so different this minute.
Yeah.
But that would be an interesting thing to do. Certainly.
I can imagine.
There's been a lot of people going to India and Africa, some of which you don't have great equipment. So a lot of the surgeries are manual as opposed to with a machine, and that's a little bit more involved and a lot more healing for people. There are a couple of surgeons who have kind of perfected an interesting technique to try to get the cataracts out without having a lot of trauma to the eye without a machine, and they've written that up, and it sounds very interesting. It'd be fun to go watch them, but there are a lot of challenges in each underserved areas to try to get provide help in a way that's useful and productive and not cause any harm.
Certainly. So another question from our broader audience wanting to know, with your efforts in Jamaica, are there things that can be done to help improve the medical access that's there, either the equipment or the supplies, things that they can do to help support the work that you're doing?
Certainly, there are donations to American Outreach Program or Jamaican Outreach Program will be very well received. We bring all of our medications, we get them donated by the pharmaceutical companies, and we have to bring a lot of the disposable equipment. The machines are there, like the microscope and the phaco machine, but we bring the disposables, and it costs money to bring people down, you know, your staff and things like that. It costs money to pay off the people who help us, because that's what they're expecting.
Mm-hmm.
And so a lot of the funding has been supported by St. John's Church in Naples, because they have a relationship with the church in Kingston, St. Pius. But yeah, we need funding for our trips, or else we can't go.
Yeah. Or
some of it has been like supplemented by the doctors because we want to make it happen, but really the foundation needs to be supported. The Jamaican Outreach Program does more than just eyes. So if you want to support the eye part, you need to save for the eye missions. Mm-hmm. But they also do some education and nourishment for the people there also. There's a lot of need. There's a lot of need. Yeah. But this program was founded out of Naples. And so that's what made it accessible for me, because I could talk to the people who had been working on it. And only one other surgeon had gone before me. So it's relatively, they'd done eye exams for many years, maybe like 13 years, but surgery had been harder to figure out. So we just started doing surgery down there in 2017.
So that actually answers another question that came in, which is, are you the only ophthalmologist who's going down there right now?
So we have two. Jeff Sim is the other one, and we're trying to get a couple more. We have two people that are interested, and then we have a number of optometrists from Naples and also from Ohio. Somehow they learned of this and they got involved, and we're happy to have their help. We need more than one for sure. We need more than one for sure. Each of these trips is really fulfilling, but it's also taxing. And so the work needs to be kind of shared.
Yeah, definitely not a vacation. It's exhausting, the work you're putting in.
No, it's not a vacation. And with eye surgery, you're working under a microscope, so you really need to be well rested and well fed, and so because any kind of little tremor, if you're tired or caffeinated or anything, comes out under the microscope. So for the surgeon, you have to really kind of be focused on what you're doing, because there's a finite period of time. We're doing a lot of surgery back to back to back to back. And then that last night, after you're done with the last case, then you can kind of breathe a sigh of relief. But it is fairly exhausting. It's a lot of work, yeah. So it's nice to have more than one set of hands. I've done a trip by myself, and I've done a trip with another surgeon. Typically, when I've gone, I've been the main surgeon. And when I went with the other surgeon, he just kind of came in to do a little bit of a break for me here or there. But I would like to see these other two surgeons coming on and maybe kind of splitting it, and that would be maybe more sustainable.
Is this kind of pro bono or volunteerism encouraged in medical school among young doctors?
Interesting. You know, there's not a real program to go over that. There's such a drive to learn. That's something that you have to kind of seek out on your own if you're interested, but they don't go through a whole lot of business classes, like if you want to be a private practice owner, or any kind of real philanthropic opportunities. There is, of course, like an ethics course in medicine, because there are a lot of, medical ethics that we need to be considerate of and well versed in, but not so much a course on philanthropy. But that'd be cool. That'd be interesting. Yeah.
So I'm in awe of your drive and enthusiasm, knowing that you have your family, your practice, all of the things that root you here in Naples, and yet you're giving so much of yourself to help others and to go above and beyond. What is it that keeps you motivated? What is it that pushes you forward and wakes you up in the morning?
I think it's because I like what I do. You know, I enjoy ophthalmology. I enjoy my relationship with my patients. I like coming to work. I don't feel like, oh no, it's Monday. I enjoy the surgeries. I get a lot of fulfillment from that. I operated yesterday, so today I saw my post-ops. It's fun to see them. It's fun to see their reaction, and they can't wait to do their second one. And you know, I try to educate people appropriately, so when they come around, they know what to expect, and it's fun to see when you kind of accomplish what you're trying to do. But I think that's the answer is I like what I do, and I got lucky with that, because we all go into our profession thinking that we're going to like it, hoping that we do.
Yes.
And I do like what I do. Otherwise, I think it would be hard to be here every day away from everybody. And I'm probably a better ophthalmologist than stay-at-home mom.
You are a wonderful mom. Don't sell yourself short on that.
I don't know. I give credit to the women who stay home. It's a lot of work.
It is. It is, absolutely. So you've embraced this passion for helping others, for really wanting to see their lives be better. What would you say to those, as a final question, what would you say to those who themselves might feel that kind of urge to help others and want to know what they can do to make the world a better place?
Well, I think one of the challenges with that is to figure out how you can give back in a meaningful way. And so I think teaming up with the right organization is part of the key, because you want to effectively help. And I think that's a lot of people's challenges. You know, how do I help people who don't have Thanksgiving dinner? What do I do? You know, like I want to make a turkey, or I want to serve at a soup kitchen, you know, like how do I do it? So I think that's hard. I think it's you have to figure out what you can do, what your talents are, you know, or your skills, and then what organization kind of matches your need that you can, you know, help give back. But I think that's a challenge. I go on with that, you know, like try to find where my kids can give back, where would they enjoy, they don't do the same things that I do, and so where would they feel a need. But I think that whatever it is that you do needs to resonate with you and be meaningful to you. Bruce gives my husband flights because that's what he can do, so he'll take supplies to certain places or transport people when there are you know, natural disasters or what have you. So I think we all kind of have to do what is in our specialty.
I love that message. Take your passion, take what you're good at, and we all have the ability to make a difference in the lives of others. Figure out how to use those talents.
Yes.
It's a wonderful message. Dr. Lynn Byerly, thank you so much for joining me today, for sharing your passion for helping others and the work you're doing with the Jamaica Outreach Program. I want to pause for a moment. We know that during this time of COVID-19, we all have this heightened awareness of our blessings, as well as a sensitivity to the needs that feel much more present around us. Each one of these One Spark sessions, we pause to acknowledge opportunities to volunteer, provide help in our area. I want to turn it over to you for a moment and ask, are there things that you know of in your field or areas that you think people could help with related to COVID-19 right now?
You mean in ophthalmology?
Sure. Or local medical opportunities?
Well, so I think for a while we needed supplies. Now we're getting supplies more, but you know, it's been a hardship to keep up with Lysol, Clorox, paper towels, masks. Still, we have masks for our staff. We don't want them to change them every day, which is not ideal. We don't have masks for our patients. We ask them to bring them in, and if they don't have one, then we need to give them something that will work, which is something like a paper towel and rubber band. So if anybody wanted to make masks, that would be a nice thing. It could be disposable ones, or if you have a way to access them and have disposable ones for patients, that'd be great. And beyond that, I think currently in our area, there are a couple things. One is, if you don't feel good, stay home. And the other thing is, I think about these kids and families that aren't in school, and so they don't have food. I'm worried about the kids that depend on school for food. That has nothing to do with my medical practice. It has more to do with me being a mom, but I know that a lot of the schools provide meals for these kids 5 days a week, breakfast and lunch. And that's been of concern. There was a family in Immokalee who went to school with one of my kids, and another mom called me and said she reached out to them, and there are 6 kids, the mom's in the fields, and 3 of them can't see. Can I see them? So I saw them, and it was just a matter of glasses, but we got them glasses, you know, just out of our pockets to try to help these kids see. But in Immokalee, certainly there's a lot of need, and there's, you know, I'm worried for those people. But I don't know what there is in my office per se, except for masking patients, and from the standpoint of the hospitals, I think they're doing fine. They're a little overserved. They probably are concerned about keeping all their staff on board. But I think in our community, there's some poverty that we don't see.
Yeah,
we don't see it.
It is definitely here in our community, and Immokalee is a deep area of concern. And so it's beautiful that what you're able to do to help that family. And I know all of us want to continue those efforts. And food insecurity is a major concern in our area. It always has been, and it's only gotten worse during this time. So I would emphasize along those lines then, for those who share Dr. Byerly's concerns, to think about giving to organizations like Meals of Hope and the Harry Chapin Food Bank, Cafe of Life, other organizations that are providing necessary food sustenance to the people of our community, both in Lee and Collier County, enabling people who otherwise would have other food sources to make it through the summer, particularly our families, those young kids who are there. So thank you so much for highlighting those. Thank you for being my guest and for sharing your passions for making our world a better place. I want to thank... Oh, my pleasure. I want to thank all those who are in our audience who are either watching or listening to our podcast for One Spark at a Time with me, Rabbi Adam Miller. If you missed any part of the experience or want to watch other episodes, the full video will be available through the Temple Shalom of Naples YouTube channel. You can also subscribe to the One Spark at a Time podcast, available on your favorite podcast provider. Friends, as Gandhi taught, be the change you want to see in the world. As we part ways today, having been inspired by the work of Dr. Lynn Byerly, may we embrace that teaching, knowing that each one of us has the power to fix our broken world, one spark at a time.